And a very good afternoon, everyone. Welcome to Issues and Attitudes. My name is Jeff Owens, General Manager at WEIU. My co-host is Tristan Thomas.
Good afternoon.
Muhammad's favorite son, as we like to call him.
Yes, sir.
There you go. And making her first appearance on our show, pinch hitting, actually, at last minute, Jen Starr, registered nurse and patient intake coordinator with Hospice at Sarah Bush Lincoln.
Good afternoon. It's a pleasure to be here.
So again, thanks for coming in. I know Sasha was supposed to be here, but she was ill a little bit, so you pinch hitting at the last second. We appreciate that very much.
Absolutely. It's my pleasure.
We always like to talk to folks from Sarah Bush. They've been good to us, and obviously with everything going on, we thought we'd touch on Sarah Bush, but not really all about COVID today. Kind of touch a little bit about what you do. So tell us a little bit about your job at Sarah Bush, Jen.
Yeah, so I am a patient care coordinator with Lincolnland Hospice. I get to work very closely with the hospital and with nursing homes and families to basically set up hospice services. So the initial call comes to me, and then I do all the legwork to get things going and get one of our nurses out to schedule an admission.
Okay. And then did you know you wanted to go into hospice care? Is it something that just happened? Tell us
Actually 22 years ago, my grandmother was diagnosed with pancreatic cancer. We had Lincolnland Hospice Services at that time. It was amazing, and I was 12 years old, and I was like, I want to be a hospice nurse.
Really?
Well, yeah. So life kind of goes on, and you make some good and bad decisions, and I became a nurse and worked in different fields. And in 2018, my mother, 58 years old, was diagnosed with stage 4 small cell lung cancer. And we had Lincolnland Hospice again, and she passed in July of 2018, and I started with Lincolnland Hospice in September of 2018.
So, wow.
Yeah.
So with your job as far as the patient intake, was this recent, Omicron surge the worst you've seen as far as amount of people coming in?
So I would say that there's just a lot of sick people right now. It's not all necessarily COVID. I'm sure you've heard of the long COVID. People are having issues months after the fact that were exacerbated by their COVID virus. So people with CHF, COPD, things like that, maybe haven't fully recovered from any of the variants. And so we're seeing that. We are seeing COVID patients. I would say most of them really in the beginning of COVID, 2020, we were seeing quite a few of COVID patients.
When you meet people and talk to people and they say, yeah, you tell them you work in hospice, what's the first thing that comes to their mind?
What? Why would you want to do that? And I quickly answer, it's the most rewarding job I've ever had. I get to help people in the worst time of their lives and offer them comfort and let them know that there's always someone there for them. And dying and death is something that we don't talk about a lot. And so being able to be, our nurses and everyone be experts on this field, it's really a holistic care that it's just amazing.
When you say rewarding, that's an interesting choice of words, because hospice care means eventually that your patient is going to no longer be with us.
Yes.
Nice way to say they're going to pass on or die.
Yes.
But it's rewarding. Is that because of how you deal with the family and the friends around
Absolutely.
them? And then obviously the person there that knows you're getting care. So, talk about that reward and what it means.
So a common misconception of hospice is that you have to be actively dying to be on hospice services, and that's not the case at all. A prognosis of 6 months or less is what Medicare guidelines are for hospice, but nobody has that expiration date. We don't know when those things are going to happen, but with the disease process and our nurses and medical directors, we're able to, kind of get an idea of a prognosis and go from there. People can be on hospice for less than a day. People can be on hospice for a year or more. And we even have people that graduate from hospice. They start doing better and have an extended prognosis, so we may discharge them. Hospice was commonly, Betty down the street got admitted to hospice, and in a few days she passes away. But if you call hospice when you start to have that in decline, where maybe you have a cancer that's incurable and it's a terminal diagnosis, call us and we're able to initiate services with you then. And then you get familiar with your nurses, you get familiar with your CNAs. And so when that time comes that things change and we're near the end, you already have that relationship. You already have all the education, all the tools that you need. As a family, as a patient, you know what's coming.
Does hospice mean they have to be somewhere else, or can they stay at home and receive services too?
Yeah, so we provide hospice in the home setting. We provide hospice in the nursing home. We provide hospice in assisted livings. And we even provide hospice in the hospital setting as a general inpatient.
Okay, interesting.
And with your job, I'm just kind of thinking about like the emotional aspect of patients and their families. Like, I imagine that's something you kind of have to manage case by case, and something you kind of have to. How do you navigate that with just an emotional time?
Yeah, so people would think that maybe you would become numb to this as you deal with it daily, but every patient, every family is different, and every approach that we take is specifically for that patient, that family, and we meet their needs, where they are. Yeah, I mean, our girls, our nurses are phenomenal. They give their heart and soul, mind, body, soul, their emotions, everything they can to these patients and families, just to make this time a little bit easier for them. And there's part of that when you leave a visit and you know that you made a breakthrough, you know that you got them to understand part of the disease process and what needs to be done to help with their comfort level. That's the rewarding part. That's when you know that you're doing something, and being able to have that impact on a family where they're going to remember you for the rest of their lives, that you were there for them, and that Lincolnland Hospice was there for them when they needed us. That's what we find to get through those rough situations. And
there's always the other side of that is, what if you have a patient and you have family, but not everybody agrees on the care course?
Yeah.
How do you navigate? I mean, who gets the ultimate decision? Is it the patient, or is it the guardian?
Yeah, so it really depends on, if the patient is alert and oriented and able to make their needs known, then they get to guide their plan of care. If they have a healthcare power of attorney or next of kin, all of those things come into play. Unfortunately, we have patients that have nobody, and we have to help find maybe long-term care placement, things like that, to ensure that they get the proper care that they need. But we have amazing social workers that have great relationships with the long-term care facilities in our county, in the 20 counties that we serve. Yeah.
And then you mentioned how you say you and your staff don't really become numb to the whole process.
Yeah.
Is that something that takes like an emotional toll on you and your staff?
It can, but being in the position that I am as a supervisor over the nurses and CNAs and et cetera, I get to be there for them as well. And they know they can call at any time, and if they need to pull over and have a moment to talk about what they just went through, they know that they're supported in that. And everyone in the office fully supports, and self-care and mental well-being is so important, and we allow our nurses to take time for that as well.
Can you take us through the process of an initial meeting with the patient and family, and kind of things that you talk about with them individually?
Yeah.
So so I think our listeners and viewers, they get an idea of if they're going to have to go through this the next year, 6 months, whatever.
Yeah.
They got a little preview of what they're going to do.
Yeah, so anyone can call our 800 number and get information or give us a referral. Say that your mom has cancer and is no longer wanting to pursue treatment. You call our 800 number. We are able to kind of talk to you about things over the phone and then set up a day where we can come out. If you're just wanting information, we can set up an informational visit. If you're wanting to go ahead and proceed with admission, we can set that up too. We get records from the doctor's office, discuss everything, and really look into what exactly is going on. From there, the nurse goes out, provides the information, and then if we proceed with admission, then that starts right then and there. We provide the medical equipment, the medications, whatever is needed. Of course, we're not going to initiate any medications that aren't needed at that time. It's all based on the patient and the patient needs.
Okay, interesting.
Yeah.
So when you've talked about rewarding a lot, but then what's the toughest part of this job?
Well, that people pass away, but at the same time, the amazing part is, if you're religious or you're not, or if you're spiritual, when you experience this as many times as we have, you know that there's something much larger than us, no matter what it is. And being present and being supportive for the family during that time, it's very, very difficult. We have children on hospice, we have teenagers, we have 2-year-olds. It's not just elderly people that have had long, fulfilling lives. So sometimes it gets you. Sometimes you have to take a step out of the room and compose yourself and come back in. Yeah.
I would imagine. So we're talking to Jen Starr of Starr Lincoln today. She's an intake coordinator with Hospice at Starr Lincolnland, really, but it's all the same.
Yes.
in our world.
Yes.
I guess I ask a little bit of this, but what if you have a patient who's made the decision of their course of care, but you have a family member or a friend or a significant other that just isn't satisfied with kind of what they believe should be a different course of care,
Yeah.
and they have some say in it, but not the full say.
Right.
And you have to just kind of listen to them, and then maybe talk to the patient. Take us through that.
Yeah. So it's very important for people to do healthcare power of attorney, financial power of attorney, a PULSE, which is a DNR. Would you like CPR, comfort care, etc. A living will, things like that, to make your needs known before it happens, to make your wishes known, and have that discussion with your family. We will listen to the family and provide education so that they're able to make the best decision possible for that. People can revoke hospice services if they feel the need to and they want to pursue treatment. However, it's our goal to educate them and make sure that they're making the best decision for the patient.
I know you mentioned at least one of the misconceptions about hospice. Are there any others that come to mind for you?
Yeah, for sure. There's a lot of terminal diagnoses. So not just cancer, not just, CHF, COPD. People have strokes that have residual effects that are terminal. There's a lot of different diagnoses that can be qualifying for hospice. So that's one. Another is that, we just start morphine and Ativan and then people pass away. That's not the case at all. You can continue all of your routine medications. The basic gist of hospice is we're comfort-focused treatment. When you elect for hospice, you're electing for no further hospitalizations. You want to stay home, stay at the nursing home, wherever you are, and remain comfortable for the duration of your life. When we come in, all of these changes, all of these things are happening already. It's our job to manage the symptoms associated with the disease process.
Yeah. What if someone, I hate to say this, but I think it needs to be asked, what if someone just is ready? They want to pass on. I know you can't do anything about it, but how do you talk to them?
Yeah, so, just because somebody wants to die doesn't mean that they're dying, right?
Yeah.
So if we have a patient that is dying, they have a diagnosis that qualifies for hospice, and they're just done. They're tired, they don't want to do therapy anymore, they don't want to go to the hospital anymore. That's okay. That's okay. That's why we're here. We'll ensure that they're properly cared for and with respect and dignity through end of life.
That was a good answer. I didn't know. I was kind of not really afraid to ask, but I thought it would needed to be subject because I've lost both my parents, and it's a tough to go through. So so many things that happen.
Absolutely.
The other one, nationwide, not just Sarah Bush and Coles County and Carl, whoever, but we have a shortage of nurses in this country right now. How has it hit you, and what can be done?
It impacts us so much. You can't run hospice, you can't run a hospital without nurses. You just can't. And so, Sarah Bush has been incredible with supporting their nurses and doing everything they can to let them know that they are appreciated. There's great sign-on bonuses right now for nurses. And there's a lot of positions at Sarah Bush right now, not just nursing, that come with wonderful sign-on bonuses. Healthcare is always needing assistance. We always need people, and Sarah Bush has just been so wonderful to everyone throughout COVID. It's just been amazing.
Well, I'm going to get to Tristan in a second, but we talked to Kyle Thompson a couple weeks ago. He's the regional superintendent for this area.
Yeah.
And he was talking about, the shortage of teachers as well. So the short of teachers and nurses. And he said that one of the reasons there's a shortage of teachers is because there's a lot of red tape at the end.
Yeah.
You graduate from Easter, but then somebody else approves whether or not you can even become a teacher.
That's right.
Is there red tape in the nursing program once you graduate and somebody else has to say qualified or not qualified?
Yeah. You have to pass boards. You can graduate from nursing school all day, but unless you pass boards, you can't work as a nurse.
Now, passing boards, that means you're taking tests and
yes,
and
you have to
equivalency,
take,
but there's nobody just judging you by
no,
a piece of paper, though.
It's a national exam for nurses.
That seems better than what Kyle was talking. I didn't realize that. I mean, Chris and I were both like dumbfounded that a person can go through that. So at least it seems like there's a better path for nurses.
Yes. Nothing's quick, though, of course. Because you have to wait for the state to do all of their part, and you may get notification that you've passed the test, but then you have to wait for your license number to pop up on that website, and then
we're in the state of Illinois.
Yep. There you go. So yeah.
What do you think? I'll go ahead, Tristan.
Yeah. So my mom is a retired nurse. That was her career.
Yeah.
And she always talked to me about how the nursing, the job of a nurse has just changed so much over time, especially in her time, but more of just navigating to online and less of a bedside manner type deal. How have you navigated some of those changes in your time in healthcare?
Yeah. So I know I look really young, but I have been a nurse since 2014, and I worked in healthcare for 10 years prior to that. So
she started in 8th grade.
Yes. So it's been hard. I went through the paper charting to computer charting. I went through, calling doctors on the phone to, electronics for everything. It's been difficult, but amazing to have all the new resources that we have because of the advancements in technology.
That was a great question, Tristan. I didn't realize your mom was a nurse either.
Mm-hmm.
So, with the things we learned, the other thing that that has changed is the technology, like you touched upon. What do you think's next? What major change do you see in nursing or at hospice care coming down the road?
Yeah. So, you mentioned bedside nursing, and the beautiful thing about hospice is that there is no time constraints. We don't want our nurses working 100-hour weeks or anything like that, but they have the ability to take 3 hours with a patient if it's necessary, because it's not on a floor in a hospital, it's not at a long-term care facility, and our job is to be there as long as we need to go through whatever we need to do for that patient and family at the time. Advancements, Sarah Bush is building the hospice house. That is going to be an amazing thing for our community. Just everything that Sarah Bush does, expanding the CCU, the new Benuti Clinic in Effingham, all of the Cancer Center. I mean, it's just amazing everything that Sarah Bush has been able to accomplish.
I wanted to get to the hospice house. Now's a good time. Tell us about, when, where, and how, and what can we expect?
Right. So everything is still in the beginnings with the hospice house. Basically, there are no hospice houses in our area. You can go to St. Louis, you can go up north, you can find them there. But around here, it's not. And with that, when we have a patient that is at the hospital, maybe that is not able to go home per se because of their condition. They need extensive care. They can go to the hospice house, and we can, symptom management there, and get them to maybe their pain managed so that they could go home and be managed at home.
It's like an intermediate.
Yeah,
kind of
it can be.
Okay.
And then also, caregiver fatigue is a huge thing. And say that you're taking care of mom at home and you want to take a vacation. Mom could come to the hospice house for, 5 days and while you go on vacation and be taken care of. There's just a lot of different things that the hospice house is going to be used for. It's going to be staffed with hospice staff, so experts in end-of-life care.
Will you be involved in that, or do you know?
I believe there are plans for me to be involved in that, and I sure hope so.
Hint to the people at
Yeah,
Starbucks, right?
right, yeah, please.
Yeah, and over the past couple of years with certain patients, did you have to move some of your services virtual at times?
Oh, my goodness, yeah.
And what was that like?
Yeah.
We finally got to COVID.
Right. So with that, yes, in the beginning of COVID, everything was so unknown and it was so difficult to manage. We did do virtual services. We did virtual visits with long-term care facilities. For home patients, we went in, we were all garbed up in our PPE and continued, but in nursing homes, it was rather difficult. But we are an essential part of the healthcare team, and so since everything got figured out with COVID, we are there. We are in the nursing homes. We are everywhere we need to be for our patients and families.
Even though things continue to change on the fly, I mean, there's new rules and new regs coming down all the time for the regular folks. I imagine hospitals, it's even, quadrupled. So how do you keep up to date on that so you know what you can't do, when you're masked, not masked, all that?
Yeah, well, fortunately, we're affiliated with Sarah Bush, and so with that, they have a great team that streamlines everything down to us so that we can continue to provide the best care and be up to date with all the new regulations.
You're from around this area, right? You're correct?
Yeah, from Sullivan.
So you've seen then Sarah Bush Grove, the one building
Oh
to
my
the
gosh,
campus.
yes.
They call it campus now.
Yes.
There. I know something just opened now, and then the hospital house. So is the hospice house going to be on campus? And,
Yes.
And what part of that would
yeah,
it be?
So it's going to be on campus, which is going to be great for patients that are critical end of life that can't maybe take an ambulance trip an hour home. They can just come to the hospice house. It's going to be by there's a pond back there.
Backside,
a little murky right now, but it's going to be all redone. It's going to be beautiful. 8 rooms, private rooms, family area, gathering area, community room. There's going to be a meditation room or a chapel, and every room is going to have like a little out spot where the doors open. They can push their bed outside, so they can get outside. There's just going to be so many things that are going to make this end-of-life journey for people the best that it possibly can be.
Okay. We're talking to Jen Starr from Starr Bush. Questions?
Yeah, so back to COVID a little bit, we're seeing some of the recent changes to the masking mandates, that kind of thing. What is your view of that for just the some of the recent changes?
Yeah, so I think that as far as healthcare goes, it's our responsibility to keep our community safe, and whatever regulations come down from the CDC, we're going to comply with those because they're the experts. And we were in N95s all the time a few weeks ago because of the positivity rate, and now we're back down to where we can wear surgical masks unless we're dealing with COVID positive patients.
And pre-COVID, did hospice workers have to wear masks when they were doing stuff, or was that?
No, we didn't, just like hospital employees didn't. If we were taking care of a patient that had, an airborne illness or contact precautions, things like that, of course, we wore the appropriate PPE, but no.
All right. We have a few minutes left today with Jen Starr. I want to ask, question about, let's delve into you a little bit. You gave us a little bit of your background, but can you tell us about college and training and some things you've done in the past?
Yeah, so I grew up in Sullivan, graduated from Sullivan High School in 2006. I worked at group homes for developmentally disabled adults for several years before I went to Lakeland and graduated with my associate degree in nursing. In 2014, I passed boards. I started working at a local nursing home in Mattoon. I did that for a couple of years. I was the director of an assisted living facility after that over in Arthur. I went to a hospital in Decatur and worked as a oncology, neurology, and surgical nurse until I went to hospice in 2018 with Sarah Bush.
All right. Any final questions?
Yeah, real quick. So with you mentioned you just went to Lakeland, correct?
Yeah.
So how, if someone is looking to get into nursing or whatever level of being a doctor, like
Yeah.
what are the in the field today, what are the different kind of benchmarks maybe for, college degrees to
Right,
get?
yeah. So I am currently working on my bachelor's degree, and there are universities that are online that really work well with full-time nurses, and Sarah Bush has some affiliation with some of those universities. So I should finish my BSN this year, no problem. I'm already 73% done. Not that I'm counting or anything. But yeah, so nursing used to be a diploma program, right? Now you can be an associate degree nurse, you can have your bachelor's, master's, you can be an APRN, you can have a doctorate in nursing. There's great programs around here through EIU, through Lakeland, Lakeview, etc., that are all wonderful programs for nurses. I would say that getting your bachelor's degree as a nurse is going to be your best bet, your best move. Magnet hospitals are coming. More and more hospitals are wanting to achieve that status. It's hard to achieve, but they prefer bachelor degree nurses. But there's a nursing shortage, so just come be a nurse.
I know tomorrow we have a bunch of students coming in the morning, and I want to find out what their careers be. I mean, nursing and teaching seem to be two avenues right
absolutely.
now. If you want a job, post Lakeland, Eastern, whatever it's going to be, that seems to be the way out there. We had a minute left. Anything we forgot that you want to touch on?
Yeah, so we have hospice volunteers. We're always looking for volunteers for hospice. You mentioned your mom's a retired nurse. They are wonderful hospice volunteers. There's lots of different things that they can do within hospice as a volunteer, and different trainings that we put them through. So if anybody's interested, they can call our 1-800 number.
Go ahead and give that. That's fine.
It's 1-800-454-4055, and that is a 24/7 number where someone can always be reached.
There you go. Well, Jen Starr, it was great to meet you. And
Thank
again,
you.
we appreciate you coming in on short notice.
Absolutely.
So I think we learned a lot. I learned some things today, and I learned that right now, if you're interested in getting jobs and you're a young person out there, nursing and teaching seem to be two quick avenues. So, again, that 1-800 number, then we'll get you out of here.
1-800-454-4055.
We'll be back next week. We're going to be talking to someone from the EIU athletic departments about sports and stuff. So I know you'll be ready, Tristan.
Right in my wheelhouse.
We are WEIU.